Our Milestones Tool, developed with patients, caregivers, and physicians, is designed to successfully prepare young Alport syndrome patients to transition from pediatric to adult nephrology over time based on age and stage of symptoms, to facilitate effective discussion and education about living with Alport syndrome between patients and their pediatric nephrologists, and to empower young patients to understand their diagnosis, make informed choices, and manage their care in age-appropriate ways. The Milestones Tool is downloadable from our website, alportsyndrome.org. We asked some young adults living with Alport syndrome their thoughts on the Milestones Tool.
My name is Brett Raisman. I'm 28 years old, and I have Alport syndrome. I wish growing up that I had these tools that the Alport Syndrome Foundation has put together for tracking your milestones and teaching kids and parents about this disease that we are still learning about as a whole. Even though I knew I had Alport syndrome my whole life, I didn't really take it seriously. I didn't understand it extremely well. And that made my transition to adult nephrology and really understanding what Alport syndrome is and what it meant to have it a lot more difficult and a lot more daunting. And I think ultimately knowledge is power. The earlier and more we can learn about this disease, both personally and in the general sense, the better everyone off will be. So it's amazing that the Alport Syndrome Foundation is putting together these new resources and collaborations with doctors around the world.
Hi, my name is Maddie. I'm 26 years old and I'm an Alport patient. When I was 21, I transitioned from a pediatric nephrologist to an adult nephrologist, and it was a challenging transition, especially because my transition of care happened during COVID, and I didn't feel well supported, and I didn't feel like I had the power to advocate for myself in the adult nephrology space. I definitely think that a tool like the Milestones Tool will help empower and educate young adults and allow them to take control of their care through the use of education and discussion with their care providers. And I think that it definitely would have benefited me in my period of care transition. And I look forward to see how it benefits other young adults who are making the transition from pediatric care to adult care.
Hi, my name is Grant Bonebrake. I am 22 years old and I am an Alport patient. I got my transplant 3 years ago in my freshman year of college. Now, it all happened very fast. I was semi-healthy and then not healthy, so the transition from pediatric for me to adult care was immediate. I needed to see an adult nephrologist in a brand new state, in a brand new city, as I was transitioning to college. So the amount of transitions that were happening at once was a lot. It was a very confusing time. It was a very exhausting time. Thank God I had my family on my side and they were able to help me through a lot of it. But if I didn't have them alongside me the entire time, I would have been completely lost. So I can't imagine how helpful a tool like the Milestones Tool would be to someone who needs all this information right at their fingertips, because like I said, my mom wasn't there. She was my biggest advocate, and without her, it would have been a real struggle. So I would imagine that having the tool to be able to look up and have the information ready in advance as well so you can prepare yourself would make everything so much smoother. All the information you have is going to help.
Hi, my name is Ben Rosengart and I'm 32 years old. I actually didn't have a pediatric nephrologist, so my transition was really just going to an adult nephrologist for the first time. I definitely think that was a bit challenging, as not only was I making tough decisions and trying to ask good questions, but I was really trying to learn and absorb a lot all at once. I think having tools such as the Milestones Tool with the Alport Syndrome Foundation is quite beneficial, as it would have allowed me to learn as I went and grow with my treatment without ever having to absorb too much at one time. More information is always better than less, and I think these are terrific tools for patients.
Thanks for watching. For questions, email info@alportsyndrome.org.